Hi, my name is Tina Garcia Miller, and I am a DNP student at Franklin University. This is my presentation on gap and SWOT analysis for Nursing 810, Foundations of the DNP, with Dr. Christine Hennessy. Between 10 to 29% of adult ICU patients will die in the ICU or soon thereafter. Of the survivors, the one-year mortality rate is over 50%, with those patients remaining to be critically ill on a chronic basis with a heavy symptom burden and poor cognitive and functional outcomes. Post-intensive care syndrome, also known as PICS, is also recognized in both these patients and their families, and it's characterized by anxiety, depression, post-traumatic stress disorder, and complicated grief. Palliative care is aimed at the relief of suffering at all stages of illness, regardless of the disease trajectory or prognosis. The trajectory of illness is variable. When looking at the long view, a patient may appear as they are steadily declining, when in fact, patients with serious illness or illnesses go through peaks and valleys of crisis, and their needs vary with disease progression. The focus slowly shifts over time. So you can see here at early in the course, at time of diagnosis, the focus is more on disease-directed therapies, and as time goes on, the focus shifts to symptom management. The first part of the DNP project exploration is a gap analysis. And gap analysis, in its simplest terms, is looking at where we are at and where we would like to be as a combined unit. And what I mean by we as a combined unit, I'm looking at the medical intensive care unit, the surgical intensive care unit, and the cardiovascular intensive care unit. A simple audit on a single day of a single unit showed that of 14 patients, 11 had criteria that made them appropriate for a palliative care referral. And of those 11, only 2 had an active consult. We must be in a place where every single patient that can benefit from this service has the opportunity to receive it. The next step was a SWOT analysis. Here we look at strengths and weaknesses, opportunities and threats. Strengths and weaknesses, I'm looking internally at our department, and opportunities and threats, I'm looking beyond it. I may be a little biased, but I feel like we have a lot of strengths. Our biggest strengths include the skills and expertise of our nurses, providers, and multidisciplinary care team, and our desire to do what is best for the patients. Our weaknesses seem to group around perceived barriers. In our organization, the biggest weakness is resistance to change. And there are reasons for this that kind of go or fall under this umbrella. Churchill et al. Also cites disparate provider opinions, unrealistic expectations, and the inability of patients to participate in goals of care discussions. Opportunities include the organizational contribution to a better quality of life, gaining a distinction among organizations in our area, and overall better performance. The top performing healthcare organizations have palliative care services. The most common threats have been the fear of decisional regret, disparate communication, and complicated family dynamics. So how are we going to get there? Well, standardized criteria already exists, and there are a number of different validated screening tools available, and the foundation is already out there for excellent staff education. So if we implement these 3 things, we could have an increase in timely referrals to palliative care. The primary goal of intensive care is to help the patient survive in an acute healthcare crisis. And keeping that goal in mind doesn't mean considering palliative care only when that goal is no longer feasible. By implementing a standardized process that utilizes established guidelines, our organization will improve the care of our patients by defining processes of care, setting expectations for providers that are guided by clinical decision-making, and establishing a foundation of accountability. Ultimately, we will transform the care experience for the patient and their family by better symptom management, shortened hospital stays, a reduction in acute care admissions, and cost containment. Thank you so much.